everyone. So, today I am here to discuss about the disorders of the GIT part number 2. Part number 1 we have already covered with the disorders of the mouth, disorders of the salivary glands, disorders of the esophagus, disorders of the intestine. So, in this unit or in this section we will cover the other disorders which are related with the intestine, then disorders related with the some accessory organs like pancreas, liver. Yes. So, let us start with the diseases of intestine. So, there is a tumor which is seen in the small or large intestine, and the tumors can be of two types. One is the benign and the malignant tumor. So, benign is rare, and the benign tumors are the local tumors, means they are located at a particular part, and malignant tumors are spreadable to the other organs and more severe. So, the basic treatment we will see with the chemotherapy. Now, surgeries are performed, surgeries are used as a treatment. Then apart from the tumors, there is a one condition called as a hernia. This hernia is associated with the diseases of the intestine, and the hernia means when the organ, a particular organ which is at its particular place, that pushes through the opening of the muscle, that will protrude out. Yes. So, the hernia is one of the condition where an organ pushes through an opening in the muscle or tissue that holds it in a place. Okay. Normally, it is under a particular tissue, it is encapsulated in a particular muscle, but in one of the condition, due to some of the circumstances, that particular organ will come out from that particular muscle or that particular tissue. Okay. For example, the intestine may break through a weakened area. Yes, in the abdominal wall, and that condition is known as a hernia. I hope this is clear, the term hernia is clear to all of you. Then coming to one of the disease is a celiac disease. Yes, the celiac disease is seen in the patients who is suffering from the sensitivity to wheat. Yes, in the wheat there is a gluten, gluten is one of the protein, and that particular person is sensitive with the protein gluten. Yes. In that particular person we have seen in response with the gluten, and that particular gluten is taken as a foreign antibody, foreign antigen, and with response with the foreign antigen our body starts to form the immunity, our body starts to form the antibody against of it. Yes. And these particular antibodies starts to invade the intestine, that will further cause the absorption problem also. Yes, in the intestine area. So, celiac disease is sometimes called as a celiac sprue or gluten sensitive enteropathy. Yes, this is called as a gluten sensitive enteropathy, means that gluten protein which is present in the wheat, that is causing the enteropathy, that is causing the problem in the intestine. It is an immune reaction. As I already told you, our body is taking the gluten as a foreign particle, foreign material. Yes, towards this our body is preparing the immune response. So, immune reaction to eating gluten, and gluten which is present in the wheat, which is present in any of the food material. Yes. So, that should be avoided. Now, a gluten which is a protein found in the wheat, the barley or the rye, and if we are taking it over time, it can cause damage to the small intestine lining, and it can prevent it from absorbing some nutrients. So, if we will see whole of the this situation, we will get to know after taking this gluten for so many time, if a person is sensitive with this particular gluten, what will happen? There will be nutritional deficiencies. Yes. So, the intestinal damage that can cause diarrhea, that can cause nutritional deficiency, that can cause fatigue, and fatigue will be just because of nutritional deficiency. Yes, weight loss will be there, nothing is going to be absorbed from that particular site. Yes, because the intestine is going damaged day by day, and then bloating is there. Yes, anemia is there. Anemia we very well know about from this whole situation why the anemia is there. Yes, iron is not absorbed and can lead to severe complications. There the different organs starts to these different organs starts to inflame. Yes, the immunity starts to invade those of the other organs as well. So, the major concern regarding the celiac disease is the allergy with the gluten, and to treat it is the best option is to avoid the gluten. Yes. Now, coming to the there are some points written with the celiac disease is there is the intestinal villi, and there is a gluten which is present in the wheat, barley or any of the food material from in which the gluten is present. That gluten is the antigen. Now, against of it antibodies are formed, and these antibodies start to invade the intestinal villi. There is a one condition, dermatitis herpetiformis. There will be itchiness on the skin area. Yes, the macules or papules are formed. Then mouth ulcers will be there. Yes, if you see here what are the other conditions associated with the celiac disease or the complications. So, see there will be restriction deficiency eating disorder, diet restriction, deficiencies eating disorder will be there, then anemia will be there, fatigue will be there, malabsorption malignancies and abdominal pain. Malabsorption of nutrients, there will be one condition called as cancer. Of course, if the nutrition will not be absorbed, it can lead to the severe diseases also. Yes, the body will be weakened. So, there will be malignancies, cancer, there will be abdomen pain, bowel, in the bowel area diarrhea will be there, flatulence will be there. It can also cause the female infertility. It can also lead to the weakness in the bones, osteoporosis. Yes. So, these are some of the common symptoms, or you can say the further complications are also written here, which are related with the celiac disease. Now, coming to the diseases of the pancreas. So, we have covered the disorders of the intestine. Now, we are covering the disorders in the accessories organ. So, pancreatitis is the inflammation of the pancreas. Now, the pancreas produces the enzyme that is helpful in the digestion. Yes, pancreas is releasing the hormones which is regulating the blood sugar level. Yes, and if there is an inflammation in the pancreas, of course, these all system will be imbalanced. These all enzymes which are formed, they will be imbalanced. These all of the hormones which are produced, they will be imbalanced. Now, pancreatitis can occur as acute or as well as chronic. Okay. Acute pancreatitis means which is sudden in onset or which is lasting for some days, whereas the chronic pancreatitis is last for years, you can say. Now, the mild cases of pancreatitis improve with the treatment. We are giving some anti-inflammatory drugs, with that we can treat it. Okay. Sometimes there is a life-threatening situations as well in the chronic pancreatitis. Sometimes there is a damage in the pancreatic islets of the Langerhans cells. At the time the insulin is not formed, at the time the glucagon is not formed. Of course, ultimately that lead to severe complications. Now, see there are the signs and symptoms of the pancreatic cancer. Pancreatitis can also lead to the pancreatic cancer. Yes. So, pancreatic cancer, that is associated with these are some conditions like low mood or depression, indigestion because the pancreas is forming pancreatic juices. Yes, diabetes just because the insulin is not formed from the pancreatic cells. Yes, that lead to diabetes. Then pale and smelly stools will be there. Jaundice will be there. Yes, it can also lead to the jaundice. There will be mid back pain, there will be abdominal pain, there will be pain on eating. Yes, indigestion will be there, fatigue will be there, unexplained weight loss. So, all of the conditions which will be appear through the indigestion, which will appear due to not absorbing the food, that will come here. Yes. So, these all of the conditions we will see in the as a signs and symptoms of the pancreatic cancer or pancreatitis as well. When we are diagnosing it, there is a one condition, that is a misdiagnosis, and it is not only associated with the pancreatitis or pancreatic cancer, it is common for all of the problems. We have seen sometimes there is one situation called misdiagnosis. Here what could be the misdiagnosis in reference with the pancreatic cancer? So, it could be mislead with the gallstones, yes, because the common symptoms we will see they are same. So, gallstones, then gastritis, irritable bowel syndrome, gastroenteritis, indigestion or liver disease, because the symptoms like abdominal pain, pain on eating, fatigue, unexplained weight loss, like pale and smelly stools, jaundice, these all of the symptoms are very common with all of these diseases here or all of these conditions. So, that sometimes they are misdiagnosed. Now, coming to the diseases of the liver. So, a very common disease here is the hepatitis, yes, that can be life threatening also. So, hepatitis refers to inflammatory condition of the liver, inflammation in the hepatic cells, yes, hepatocytes. This hepatitis is caused due to the viral infection. Yes, there are the virus, hepatitis virus A, hepatitis virus B, hepatitis virus C, hepatitis virus D, hepatitis virus E. Yes, these all viruses can cause hepatitis. Now, these include autoimmune hepatitis as well. Sometimes our immunity is working against ourselves. Yes, that can also lead to the inflammation in the hepatocytes in the liver. Yes. Now, autoimmune hepatitis is the disease that occurs when our body makes antibodies against ourselves. Yes. Now, see, this is one diagram here which is showing the 5 types of viruses, the hepatitis virus A, hepatitis virus B, virus C, virus D and virus E. Yes, how it spreads and the prevention and the treatment. So, hepatitis virus A is patient is getting it from the contaminated food and water. This can be prevented through improved hygiene or by the vaccinations. Vaccinations are available for hepatitis virus A. If we will talk about the treatment, there is no treatment. Yes, we can only prevent it through maintaining the hygiene or through taking the vaccination. Now, coming to hepatitis virus B. This is we are getting from the contact with infected body fluids or through the injections, okay, through the transfusion fluids from one patient to the another person it is transferred. So, how we can prevent the situation? Of course, when the screening is proper. When we are giving transfusion fluids to any person, they should be properly screened. So, blood screening will be there, improved hygiene, vaccination is there for the prevention of hepatitis B virus. I will talk about the treatment. So, there are some treatment like nucleoside analogues like pegylated interferons, yes, and these interferons are used in the treatment of hepatitis B virus. Now, we will talk about the hepatitis C virus. Patient is getting it through the intravenous drug use. If the particular product is not sterilized, at the time the patient or any person will get it. How will prevent? Similar way, blood screening, sterile needle should be used, yes, sanitary should be there, sanitary healthcare setting should be there, yes. And if I will talk about the treatment, so there are some antiviral drugs or pegylated interferons. So, they can be used for the treatment. We will talk about the hepatitis D virus. So, it is spread through the contact with infected blood. Yes, through the infected blood it will come in the any of the person. And how we can prevent? The similar way by it is transferred, if will avoid this, of course will prevent it. So, blood screening, sterile needles, practice safe sex, these all of the conditions it will do, of course will prevent. Then chronic hepatitis D can be treated with interferons. Acute hepatitis D is generally not treated with the drugs. Chronic hepatitis D we are treating with the interferons. Yes. Then hepatitis E virus, that is spread through the blood to blood contact or unsafe sex or during the childbirth. Okay, that can be transferred from mother to the baby. So, for the hepatitis E virus, the prevention is improved hygiene, avoid uncooked food, fruits or vegetables. Yes. And I will see the drugs. So, there are some common antiviral drugs. There is a ribavirin drug which is used for treating this hepatitis E virus from transferring from mother to the baby. Yes. So, these are some of the common prevention and treatment for the particular virus type. Now, coming to cirrhosis of the liver. Now, cirrhosis is the late stage. Yes, initially there is an inflammation in the liver, then the last condition we will see, the last stage we will see is as a form of a cirrhosis. What happens here? There is a scarring, there is a fibrosis formation of the liver which is caused by many forms of the liver diseases or conditions. Yes. So, this is we are saying means the liver is losing the functionality. Yes. So, this is one condition, the cirrhosis. Now, a cirrhosis, if as a cirrhosis progresses, more and more scar tissues are formed and then making the liver into the decompensated cirrhosis. There is a two condition, compensated cirrhosis and decompensated cirrhosis. Compensated cirrhosis is usually not giving that much of the symptoms, and at that particular time the liver is functioning properly. But in the decompensated cirrhosis, what is going? The liver is not functioning, liver is not able to metabolize the content, liver is not able to eliminate the waste product. Yes, so means the liver lost its functionality, that is a decompensated cirrhosis. That particular condition will appear. Yes. Now, coming to the liver failure. So, ultimate stage is the liver failure. When there will be cirrhosis or due to some other late stage or last stage of the liver, which is losing the ability to function properly, the function of the liver, that can lead to the liver failure. Yes. And this occurs when the liver function is markedly impaired. Yes. It can be acute, it can be sudden in onset, it can be chronic, means it is taking so many times, from so many times it is going to grade one day by day, day by day. Yes. So, there will be acute viral hepatitis that can lead to the liver failure. Then there is extensive necrosis which can be associated with the poisoning, or it can cause due to the cirrhosis of the liver, which is the last stage we have already covered. Now, coming to the hepatic encephalopathy. Yes. So, hepatic encephalopathy, there are two terms, one is the hepatic, another is the encephalopathy. Hepatic is we are talking about the liver, and encephalopathy means there is a problem with encephalite, means brain, it is affecting the brain. Yes. So, how the liver is affecting the brain? See, it is causing the toxicity. Yes. When the liver is losing its functionality, means the liver is losing the function to eliminate the toxins. At that time the toxins will increase in the blood, that can lead to cause the damage in the brain. Yes. That can cause the toxicity, or that can lead the problem associated with the brain, that can lead to the cognitive impairment or nerve disorder. So, hepatic encephalopathy is an often temporary neurological disorder due to chronic severe liver disease. Yes. If there is a means in the cirrhosis, we will find this particular problem, yes, or in the liver failure, we will find this particular problem. So, a diseased liver struggles because the liver is in a diseased condition, the liver is are not properly functioning. At the time the liver is struggling to filter the toxin, yes, liver is the liver organ is detoxifying the drugs, detoxifying the material, yes, it is detoxifying the content which we have in the body. So, it is filtering the toxins or substances created from the breakdown of the food or the alcohol or the medication, yes. So, if there is a struggle in it, of course, that will ultimately that will ultimately increase in our bloodstream, and that will go in the brain, okay. And these toxins build up in our body, they will travel in the brain, they will cause the they will impair the function of the brain, they can cause the cognitive impairment, yes. So, that is a hepatic encephalopathy. Now, coming to the jaundice. Now, jaundice is one of the problem if there is a problem in the liver function, yes. So, jaundice is caused by the buildup of bilirubin. When there is an increased level of bilirubin, that will cause the jaundice, yes. So, the bilirubin, what is bilirubin? Firstly, we have to understand the bilirubin is the waste material in the blood. It is formed from the metabolism of or breakdown of RBCs, yes, and that particular RBC will be breakdown into heme and the biliverdin, yes, and that biliverdin is then transferred to the bilirubin, yes, and then this will move to the bloodstream in the form of conjugation, unconjugation, these type of things will come. So, this is how the bilirubin can be increased in the body when there is the breakdown, severe breakdown of RBC or the bilirubin is formed too much, yes. So, see, an inflamed liver is or obstructed bile duct can lead to the jaundice, yes, when there is a obstruction in the liver, when there is a obstruction in the bile duct which is processing this, and that can lead to the accumulation of the bilirubin. Now, symptoms will be yellow color on the skin, yes. There will be a whiteness of the skin, whiteness of the eyes, there will be a dark urine, means the yellowness in this urine will be seen, itchiness on the body can be feel, yes. Now, see, this is the one diagram. So, we will elaborate in this how the bilirubin is accumulated or it will increase in the body. So, see the RBCs, yes, these RBCs will be breakdown in the RES system, reticuloendothelial system, yes. So, these RBCs are generally breakdown in the spleen. Now, see, when the RBC is breakdown, in this RBC hemoglobin is present and this hemoglobin is carrying actually the oxygen, yes. So, the RBC is breakdown here and in this hemoglobin is present. So, heme part is separated out and globin part is separated out, yes. Now, heme is converted by heme oxygenase to biliverdin. Now, this biliverdin is then transferred to bilirubin. Now, this bilirubin is in the unconjugated form. So, it cannot be transferred in the bloodstream. It needs something, means it needs a carrier. So, bilirubin needs albumin. Yes, albumin is one of the protein. Bilirubin is connected with the albumin and then it will go to the liver. Yes, in the liver it is known as an unconjugated bilirubin which is attached with the albumin. Now, that is a water insoluble form. Now, in the liver it is conjugated with glucuronic acid which is called as a conjugated bilirubin. When the bilirubin is attached with a glucuronic acid, it is called as conjugated bilirubin. Now, this conjugated bilirubin will come in the intestine, Yes, from the bloodstream it will come in the intestine, and in the intestine we are seeing the conjugated bilirubin is turning to the urobilinogen. That urobilinogen in the large intestine will again converted into stercobilin. That stercobilin is giving color in the fecus, and some part of the urobilinogen is also transferred to the kidney, that is coming in the urine. Yes. Now, if you will see the obstruction, here is the hemolytic jaundice, means the severe RBCs, the RBCs are breakdown, excessive breakdown of RBC, that can lead to jaundice. Then hepatocellular jaundice means here the conjugation is not proper. If it is there, of course the bilirubin will be, that unconjugated bilirubin will be in the blood. Yes. And there is a obstructive jaundice which is unable to excrete the conjugated bilirubin. If there is obstruction in this particular area, that can lead to the formation of or excessness of the this conjugated bilirubin. Yes. So, these are some of the conditions associated why the jaundice is there. Then there is a diseases of the gallbladder or the bile duct. There are sometimes stone formation, that is called as a cholelithiasis. Yes. In this we can see the stone formation is there. This is due to the excessive secretions. Yes. At that time these the bile salts they will start to form the stones. Similarly, we have a cholecystitis. Cholecystitis means the inflammation of the gallbladder. Yes. This is the inflammation, we can see the inflammation here, inflammation in this particular area. Yes. And this is due to the gallstones, the stones are formed in this particular area, that can lead to the inflammation, or sometimes the severe infection or severe illness is there. Yes. That can also lead to the inflammation in the gallbladder. Similarly, there can be inflammation in the bile duct as well, that is called as a cholangitis. Yes, see the inflammation in this, yes, bile duct, that is called as a cholangitis, means the infection of the bile duct, that is leading to the inflammation in the ductal area. I hope this is clear to all of you, these terms are clear to all of you. Thank you so much everyone. We will meet in the next session with the next part of the digestive system.